Hello, welcome to Public Health 101, Essentials in Action. This presentation makes up part one of the first module of the Elko County Health Board Toolkit. My name is Valerie Quape, and I'm a graduate intern from the University of Nevada, Reno's Master of Public Health program. And this presentation is part of an internship I am completing with the University School of Medicine, Office of Statewide Initiatives. The purpose of this module is to give a broad overview of the discipline of public health and to help viewers understand that no matter the work they do in the community, they have a role in the local public health system. This module is based off of a presentation developed by the University of Arizona for use by the Western Region Public Health Training Center, of which the Nevada Public Health Training Center is a member. Although many aspects of the presentation have been altered from its original version to better describe the structures of state and local public health systems found in Nevada, two of the videos included here give examples of public health systems within the context of those in Arizona. However, much of the content of these interviews still applies to issues facing local public health systems here in Nevada today. So, without further ado, let's get started. The material in this presentation is aimed at achieving the following learning objectives. In part one, so this part of the presentation, we will discuss public health in general terms, as well as describe how different sectors within the community can work together as a part of the public health system. This is important in understanding how your work, directly or indirectly, contributes to community health. In part two, we will also discuss the 10 essential public health services and how those align with the 3 core functions of public health systems. From here, we will also discuss both local and national examples of programs and services conducted by official public health agencies and how other non-traditional public health partners can also contribute. Of course, we will also talk about how public health organizations work together at the federal, state, and local levels. So what words come to mind when you hear the phrase public health? Some of you may think of things such as community, promotion, immunization, prevention, epidemiology, or even just well-being. So now that we've kind of discussed some of these words, let's compare these with the World Health Organization's definition of public health. According to the World Health Organization, or WHO, public health is the science and art of promoting health, preventing disease, and prolonging life through organized efforts of society. What does it mean when we describe the science and art? Let's look at a real-world example of public health in action in the context of an investigation of a group of cases of foodborne illness. The science of public health comes into play in understanding the biology associated with the illness, how it's able to contaminate food, any incubation periods between infection and symptoms, and many other factors. The art can be found in the way in which the investigation is conducted, such as ensuring appropriate communication with all appropriate agencies, physicians, and patients, as well as demonstrating cultural competence. What if these cases were found among people from a specific ethnic group? Are there cultural food handling or preparation practices that may put them at risk for infection? How can you discuss reducing risks associated with infection in a way that comes from a place of respecting their culture? On that note, although we have discussed several words associated with public health, one of the most important words is trust. As members of the public health system, we have to be sure to provide services for people with not only their needs in mind, but also with respect for them as people. Through transparency, communication, respect, and understanding health and biomedical ethics, we can approach public health issues in a manner that protects the trust in the public health system on the part of community members. We will discuss ethics and public health practice in more detail in Module 4 of this toolkit. So, what is the difference between medicine and public health? While medicine usually affects one person or small groups of people at a time through direct medical care, public health has the ability to touch entire communities or populations at a time through health programs or policy development. In this way, public health touches every individual every day, although they may not even realize it. Their approaches and aims also differ. Healthcare deals with your immediate medical condition and the costs related to that, while public health takes a broader approach, looking at how the environments, politics, and any social situations may interact with our biology and impact our health and wellness with an overall goal of preventing disease and promoting health for all. In other words, population based public health means strategy is needed. So let's discuss the purpose of public health in more detail. The primary purposes of public health are prevention and protection, including against hazards associated with infectious disease or foodborne or waterborne illness, environmental hazards such as air or water pollution, and workplace or motor vehicle related injuries. In addition, public health practitioners work with other organizations to plan for various types of natural and man-made emergencies so that they can help protect community health in these situations. They ensure that community members receive health education in order to take measures to protect their own health and that of their families. And they work with community members and healthcare providers to improve access to quality healthcare through referral systems, education, and sometimes by providing affordable healthcare services directly. Let's talk a little bit about what public health has been able to achieve in the last century. There are many achievements on this list that have helped reduce morbidity and mortality in America, oftentimes through a coordinated effort among public health agencies and other non-traditional public health partners. Let's look at motor vehicle safety as an example. Since 1925, the annual death rate from motor vehicle travel has decreased 90%. Seatbelts have saved approximately 85,000 lives. Child safety seats have reduced the risk of infant death by 69%. Community awareness and DWI, driving while intoxicated, also known as DUI or driving under the influence regulations, have helped reduce alcohol-related deaths by 32%. This is an excellent example of an accomplishment that was not made by one specific public health agency, but rather by the larger public health system nationwide, including law enforcement, lawmakers, departments of transportation, automobile manufacturers, car seat manufacturers, and others. This graphic from the CDC takes a federal perspective, but outlines how the governmental agencies and healthcare workforce work together. Here, federal public health agencies oversee and assist in programs implemented by the state, local, tribal, and territorial health departments, who in turn work in conjunction with other branches of government and healthcare organizations. However, it is not that public health oversees the work of media, nonprofits, educational organizations, and private industry. It's that these non-traditional public health system partners are the foundation upon which the public health organizations work. And many aspects of public health practice are either improved and sometimes made possible by the work of these other organizations. We'll see some other illustrations of public health systems that depict a more collaborative system later in this presentation. Let's review this list of federal public health responsibilities. First, to act when health threats may span more than one state, a region, or the entire nation. To act where the solutions may be beyond the jurisdiction of individual states. To act to assist the states when they lack the expertise or resources to effectively respond in a public health emergency, such as a natural disaster, bioterrorism, or a new or emerging disease. To facilitate the formulation of public health goals, usually in collaboration with state governments, local governments, and also other stakeholders as appropriate. And lastly, to ensure all levels of government have the capabilities to provide essential public health services. What you'll notice from this list is that their primary purpose is to act as a convening body, bringing multiple agencies to the table to solve problems or address emergencies. Federal government plays a crucial role in providing leadership and oversight. This often takes the form of aiding in the development of either nationwide or state-specific public health goals, policy to facilitate those goals, and standards of practice to ensure that those policies are being followed. In addition, Federal public health agencies play a large part in the state and local public health systems by contributing operational and financial resources, often taking the form of grants or technical assistance, financing research and higher education to uncover best practices and how to address new or complex problems, and in the supporting of the development of scientific and technological tools to improve the effectiveness of public health infrastructure at all levels, thus translating research into practice. Although the federal government plays a major role in public health, state and local health departments retain the primary responsibility for health under the U.S. Constitution. It's important to remember that as we discuss state roles in this presentation, we are speaking in general terms regarding common roles and responsibilities of state health departments across the U.S., not of the Nevada Division of Public and Behavioral Health specifically. State health departments may take on many roles within their public health systems. Some of these roles may include screening for diseases and conditions such as newborn screening, screening for HIV or AIDS, tuberculosis, or diabetes, treatment for diseases, including tuberculosis, sexually transmitted diseases, HIV, or diabetes, technical assistance and training, including that for emergency responders, hospitals, and local health departments in areas such as data management, policy development, and many other specific areas of practice. Providing state laboratory services, including testing for bioterrorism agents, foodborne illnesses, environmental toxins, and influenza typing. And finally, state health departments may also conduct epidemiological services and disease surveillance, such as data collection and epidemiology on behavioral risk factors, communicable or infectious diseases, vital statistics, and also other chronic diseases. But how are state public health departments funded? In 2011, the largest source of state health agency revenue was federal funds, followed by state general funds. Medicare and Medicaid revenue was the smallest revenue source for state health agencies. It should be noted that this does not reflect Nevada's public health funding mix. Now let's discuss the roles and responsibilities of local boards of health. Like our conversations regarding those at the state level, the activities discussed here regarding local boards of health are generalized to those across the country, not to Nevada specifically. We'll speak more to the specific roles of local boards of health in Nevada in Module 3 of this toolkit. Sometimes a local board of health is also called a health board, as in the Elko County Health Board. According to this definition from the National Association of Local Boards of Health, or NALBO, a local board of health is a legally designated body whose role is to protect and promote the health of the community. Although most provide oversight to a local health department, not all public health systems include a health department at the county or city level. In this case, the local board of health roles and responsibilities may take a different approach to affecting population health. However, all local boards of health strive to promote public health activities within their communities, such as community health needs assessments and improvement planning. In addition, reviewing public health policies at regular intervals to ensure alignment with national standards and community needs is a common activity of local boards of health. It is the responsibility of board members to keep health in mind in the development and review of policy and codes not directly associated with public health itself. This is an approach called health in all policies. Here is a list of the most common activities performed by local boards of health across the U.S. As you can see, most of these activities are associated with policy development and review, as well as giving direction to a local public health department, or making recommendations to other organizations that address community health. You'll notice that some of the activities listed include promoting the completion of community health assessments and giving direction to establish synchronized health priorities to be addressed within their community. These are activities that are often completed by a board who is working in conjunction with a local health department, but may also be completed through partnerships developed with other community organizations, particularly in communities that do not have a local health department. When we discuss the roles and responsibilities of public health organizations and governance at the state and local levels, it's important to first understand the difference in structures that states adopt to address public health. There are several ways that public health agencies function at the local and state levels. In decentralized systems, local health departments, which are offices of county or city government and governed by a local board of health, implement public health programs and services within communities, oftentimes at the county level. An example of this type of system would be California. In centralized systems, all local public health offices are satellite offices of the state public health agency itself, rather than being part of local government. An example of this would be Mississippi. Mixed systems share attributes of decentralized and centralized systems, often with local health departments run by local government in select areas or population centers, while the state agency may carry the responsibility for public health services in other areas. Nevada is an example of a mixed system. In the case of shared systems, authority over public health and a local public health department is shared by the state health department and the local board of health. It's also important to note that even within these categories, there is a great deal of variance among states as to how their systems are set up. Although two states may technically fit into the same category, how these systems actually function may be very different depending on the state's funding mix and availability, community priorities, and state and local political influences. This map indicates which states are governed in which way: local or decentralized systems, mixed, state or centralized systems, and shared systems. As previously discussed, Nevada is considered a mixed system according to this definition. However, there are several similar reports available, and depending on the definitions used to classify systems and when the data was collected, Nevada has also been classified as largely decentralized, based on local health department coverage at its population centers by the only 3 local health departments or districts in the state. Those are Southern Nevada Health District, Washoe County Health District, and Carson City Health and Human Services. So on that note, what is the difference between a local board of health and a local health department? It may be easier to describe these differences and how they function in different types of systems. Decentralized systems are common, and so you will see many public health resources for local boards of health that assume this format. In this example, the local board of health acts as the governing entity to the local health department. There is two-way communication among the state-level public health agency and the local board of health and the local health department. However, in the end, all of these agencies answer to the public and respond to community needs. As the governing entity of the local health department, the local board of health may provide direction on the department's activities based on community needs. This list includes the most common services and activities provided by local health departments in the U.S. As you can see, most of these services revolve around the provision of immunizations, environmental health and safety inspections, and other forms of disease prevention and control. However, many health departments provide other services, including expanded clinical services, health education programs, social services, and many others. What services the health department provides largely depends on community needs and the funding resources available. In addition, it should be noted that all organizations that are involved in services that influence population health are considered to be a part of the local public health system, which we will talk about shortly. In centralized systems, the formal structure excludes a local health department. Since there is no health department operated by the local government, the state-level public health agency and the local board of health work in conjunction to provide local public health services. In centralized systems, it is even more crucial that the local board of health voices the needs of the community to the state health agency or any other agency that is contracted to provide public health services within their jurisdiction. In these circumstances, it is common that the state public health department will provide typical public health services, such as restaurant inspections, disease investigations, or others. But it is often a network of community organizations that may provide the programs and services more commonly associated with community health, such as health education, tobacco use prevention programs, immunizations, maternal and child health care services, and physical activity and nutrition programs, just to name a few. Now let's discuss what forms public health organizations may take in the context of American Indian tribes. There are organizations defined or recognized as tribal health departments, but then there is also a broader set of organizations or entities that provide services in a tribal setting. A tribal health department is a health department, corporation, or organization operated under the jurisdiction of a federally recognized tribe or association of federally recognized tribes, and may be funded by the tribe or tribes, and/or contract services from Indian Health Services. Conversely, the term tribal health organization includes tribal health departments, as well as Indian Health Service units, area Indian Health Boards, and urban Indian Health Centers. So this is really a much broader term that relates to a variety of entities that may provide health services in a tribal setting. Before we begin our discussion of non-governmental organizations and public health systems, I would like to share a quote from Karen Glantz from her book, Health Behavior and Health Education. It is logical to expect that there is strength in numbers and that partnerships can mobilize material and human resources and be more effective at achieving desired goals than individuals working alone. In other words, government is not alone in developing, designing, or delivering public health. Truly, it takes a village. So, what are the characteristics of a local public health system, or LPHS? The hallmark of a high-performing LPHS is a network of strong partnerships developed by and maintained through open and clear communication among all partners. This communication includes discussing activities and programming offered by each organization, which helps reduce duplication of services and provides opportunities for organizations within the system to team up to address a particular program or project. For example, if two organizations are intending to provide programming to address maternal and child health, through open communication, they can partner on these projects and bring different resources to the table. In addition, it is important to adopt synchronized, system-wide public health priorities and objectives in order to approach those issues using all available resources. Guidance and leadership provided by a local public health agency or a local board of health can help tie these activities together, as they can act as a convener, bringing new partners to the table and acting as a neutral party where appropriate. Feedback loops that provide communication among the multiple levels of governmental and non-governmental organizations help all partners to be informed of current or upcoming challenges and opportunities facing community projects. As we look through these different functions, it's apparent that it is impossible for the local public health system to function without non-governmental organizations. In fact, oftentimes, most of the organizations that make up a local public health system are actually not associated with state or local government at all. This graphic illustrates that point. The public health system includes all public, private, and volunteer entities that contribute to public health activities within a given area. Entities within a public health system can include hospitals, physicians, managed care organizations, environmental health agencies, social service agencies, educational systems, community-based organizations, religious institutions, and many others. All of these organizations play a role in working to improve the public's health. Here, the center of the system is the public health agency. It's important to remember that this may not be a local health department, but may be a local board of health, or maybe the state public health agency in some cases. This isn't to say that the public health agency is necessarily responsible for directly purveying the public health services, but works with all partners within the system to ensure that the needs of the community are met, and if not, works with the partners within the system to find solutions to meet those needs. Here is another depiction of how local public health systems may work together. In this graphic, governmental public health agencies are brought into the loop at all levels. The goal here is to have a system of partnerships that interact collaboratively and effectively at the federal, state, local, and tribal levels, and with each other. Some local examples of organizations that are a part of the local public health system in Elko include the newly formed Elko County Board of Health, PACE Coalition, Elko Family Resource Center, Nevada Health Centers, Elko County School District and its nursing staff, institutions of higher education such as the University of Nevada and Great Basin College, social service organizations, CPS and domestic violence programs, and last but not least, organizations providing mental health and substance abuse programs. There are also many other organizations and government agencies that are involved in the local public health system. These include law enforcement, departments of transportation, parks and recreation departments, emergency medical services, local hospitals, allied healthcare providers, local businesses and employers, and many others. We've come to the end of part 1 of this presentation. Thank you very much for your attention and time. Please continue the module by viewing part 2, where we will discuss the 10 essential public health services and how they are addressed by local public health systems. If you have any questions regarding this toolkit, I can be reached at this email address during the summer of 2017. Thank you again for your participation in this project.